So good afternoon, everybody. Welcome to Family Partners of Morris and Sussex County's Lunch and Learn. Today we have Helen O'Shea with the County of Sussex, and she's going to talk to us about special child health services and assistance for children who need case management from birth through 21. So with that, I'm going to turn it over to Helen and your team, and thank you for joining us.
Hello, everybody. Again, my name is Helen O'Shea. I'm a registered nurse, and I'm the unit coordinator for Special Child Health Services. First of all, I'd like to say thank you for giving me the opportunity to discuss the services with you. Special Child Health Services is housed in Department of Health over on 201 Beechworth Road in Hamburg in the public health nursing. We have a case management unit, and we have 3 registered nurses, myself, Helen Ann Teenan, and Ann Sullivan, and we provide case management to children and their families with special needs, birth through their 21st birthday. Our program has been in Sussex County since 1984, and each county has their own program. Each program is somewhat specific to their county and the people that they serve. Our program is free of charge to county residents. There's no income limitations to who can receive them. It's paid for a grant from the New Jersey Department of Health and supported by our county commissioners. And we get referrals from such places as the Birth and Autism Registry, which is a registry where if children get diagnosed either at birth or with some kind of illness or later on with autism, it can be anonymous registry, but it's very secure. And then we receive the referrals and we reach out to the families that way. We can get them from schools or families, other community partners, through early intervention, which is birth to 3, doctors or hospitals. Sometimes people can go on our county website and learn about our services, and SPAN, which is the Statewide Parent Advocacy Network. So what happens is that once we get a referral, we will reach out to the family, and we try to first give them a call, and if they answer, that's fabulous. We make our connection, and if not, we'll send 2 letters to follow up 15 days apart, just to try and connect with each family. Once we do make our connection, we individualize our call to meet the needs of the family. So, each call is different, each call is individualized. Each time we speak to the family, their needs may change and different, issues can come up. So we do a review. So if somebody is on our active caseload, they will receive a call from us about every 6 months or whatever is appropriate for that family. And it'll depend on if they have immediate needs that, we need to, if we made a referral to somebody and we wanted to follow up with them, we'll do that according to whatever we and the parent agrees. The parent, of course, is very much a part of the team and the process, and their needs. So today I might call somebody and they're having a problem with their insurance, and the next time I talk to them, their insurance is cleared up, but they may have a problem with school. Or I might reach out to you and everything is going pretty good, and then we'll set a date for the next time. In addition to the calls that we make, I also have a resource email list that I send out. So even if people leave our active cases, a lot of times they'll stay on our email resource list. So whatever comes across my desk, I will, sort of figure out if I think that that's appropriate for them or not. And everybody will get a blast. So sometimes it will be appropriate for you, and sometimes I'll say, share it with somebody that you know. So it'll just depend on what the situation is. And so then we'll make a plan, and then we follow our plan. And so the type of things that we discuss, we have 5 categories that we discuss. We discuss medical. We want to make sure that everybody has a pediatrician or a primary care physician. Mostly in our case, they're pediatricians. Make sure that they're meeting their needs. We also discuss if they have a specialist. Many times our children see developmental pediatricians. At this time, the wait is really long for the developmental pediatrician, but we'll make a suggestion like to go on to a wait list, for them to be able to follow up. And then we also provide a list of developmental pediatricians to families. Then another thing that we discuss are dentists. Dentists could be a little bit on the tricky side for some of our children because of sensory stuff. They, may have sensory needs that they're afraid to go. Not that everybody couldn't be afraid to go, but we do have a list of dentists that over the years we've compiled from people telling us that they worked for their families. And again, it's a general list, and we do try to, say who will take regular private insurance versus New Jersey family care insurance. But, it'll depend on what we do. We send the whole list, and the families will sort of reach out and cross-check with their insurance. The next thing we discuss is their developmental growth, how they're making out. In the beginning, if they're going to be going to early intervention, we discuss milestones, give them the information to be able to review what milestones their children should be up to. And then if the need be, then we'll refer to early intervention. We can either do that on the phone or on the computer, depending on when we can do it or they can do it. So just to get the referral for the early intervention process going. And that would involve an evaluation to see if they qualify for early intervention. Early intervention children would have a 33% delay in one area or a 25% delay in two areas in order to qualify for their services. And the fee for early intervention is based on income. So if there is a sliding scale type thing that you can go on and look on and see how much your cost share would be for your services. Then the next category to talk about is school. How is school going, what grade they're in, what type of class they're in, if they have an IEP, if they have a 504, if they have a one-on-one aid, just depending on, how they're making out this school year. Another thing we discuss is if they go to the extended school year. Some of the children go to the extended school year so they keep up on their skills. And then we can always refer to the statewide parent advocacy network if people are having difficulty or if they need to know their rights. We have information on parental rights in education. We also talk about the special education parent advisory group. That's a group at each school where families of children with special needs can come together with administration to talk about the needs of the school in general. It's not specific to their child, but just overall for the schools. Then we talk about the therapies they're getting. So many of our children get physical therapy, which would focus on their gross motor skills, like jumping and walking and all that kind of stuff. Occupational therapies, so those could be for fine motor skills, which would be like tying your shoe or zippering your coat, or they could also be sensory needs. So it'll just depend on, or they could be both. And then speech therapy, is your child communicating? How are they communicating? Are they using one word phrases to communicate? Are they able to put two words together? Do they point? How are they communicating with you? And also many of our children that are diagnosed with autism, they get applied behavioral analysis, or also known as ABA. So some of these children get these services in school, and some of them get them, privately at home after school, or they can go to a center. The next thing we talk about is their social and emotional. How are they making out? Does the family have insurance? If they have insurance, what kind of insurance do they have? We talk about the Catastrophic Illness and Children Relief Fund, and that's a program where families that have medical bills that are more than 10% of their income, 10% of the first 100,000 and 15% after that, they can apply for assistance through the Catastrophic Illness Children Relief Fund to assist with their bills. Of course, we have to tell the families that that's not a guaranteed, fund, but with the application, they'll review it and decide. And we tell people that they do want to give the money away. They want to be able to assist you. And you just have to qualify. And then we also talk about programs and support groups, like Mom to Mom is an example, or you could have local support groups. We talk about programs for the children and the teenagers, what they have, and where we can go to. So some of the people that we refer to is, like I said, the early intervention. The case manager can refer, or you can call. You can call or go on the website yourself. That's one thing. The catastrophic list we just discussed. What happens is that if somebody goes online and starts a catastrophic application, we get the case manager, will get the information, and then we'll reach out to the family just to make sure that they have insurance, that they have, situations that they're connected to resources. So, you could have a thing where you have a high copay, or you could have a situation where, let's say, you're in between insurance. It doesn't have to be a catastrophic illness. It's the catastrophic is the money. So let's say that you broke your arm, your child broke their arm, but they didn't have their insurance at that time. So the bill would be a lot if you had to go and have surgery. So that's the kind of bill, if you qualified, you could, apply for. Then we also have, like I said, the SPAN. We work with SPAN to find resources for families and let the parents know their rights. And we're also in partnership with them, and also we're in partnerships with Autism Speaks. And that is a very good resource in terms of finding out more about if you were diagnosed with autism. Also, we work with Perform Care. Perform Care has two sides. They have a behavioral health side, which if, let's say, your child was having difficulty with their behaviors, and you thought that there was, a situation where you needed to have assistance right away, you can call them, and they will, it's supposed to be 24 hours a day. You'll call them, and they should come out to their home if they assess that that's what they need to. That's one side of the Perform Care. The other side of the Perform Care is the IDD or DD side, and that's the side where it's for children who have developmental disabilities. And what happens is you go on and you fill out an application, and they'll ask a lot of questions. It's quite a process, but once you get it done, they can help you with what they call respite, and respite services can provide assistance with caring for your child. And so that can be a respite, self-hired respite, where you find somebody that you'll get a budget, and then you'll pay them out of that budget. Or they can have agency respite, where the agency will find you a person, or you can have respite where they go to SCARC. They have programs at SCARC. They can go to those programs like on a Saturday morning, depending on their age group, and you can get respite that way. But you can go one of the three, not all three. And then we also work with Dawn, Center for Independent Living. We're always looking for transition. So of course these children are like everybody, like all of us, are transitioning throughout their lifestyle. So it's, transition from early intervention to school, from school to middle school, and then, all the things that come with that, and then to high school, and eventually to adulthood. So we're always planning and looking to see how we can assist our families and our children, to live the best life that they can. Dawn has recently got a van, a a mobile van, and it'll come to certain locations around Sussex County. So we share out that those locations on our email with families. So they have a lot of information where they can share. And they also have programs to help families and children to transition, like they'll have maybe a cooking class or a helping with your money, you know, that type of thing. Or they can also meet you where you are. Another place that we work a great deal with is Project Self-Sufficiency. Project Self-Sufficiency, we go to many of their general council meetings, and we refer to them in terms of if our families need assistance, let's say with a food bank or with, you know, depending on what they need. At Christmas time, they have a big toy bank thing where people can come and get toys for their children, and you know, develop the appropriate toys for their children. So we do that, and we also attend meetings at the Disability Services Advisory Council. That's held over in the administration building for Sussex County. And all these are just opportunities for us to reach out, you know, to the public and to other community partners to see we're always looking and trying and seeing and doing, and we say, you know, it takes a village to help, you know, get our families the stuff that they need, and, you know, the unique needs of the people here in Sussex County, right? Because every county is going to have a little bit different. So that's, let me see what else I have. Some of the other stuff that we work on is the medical homes. We, you know, want families to be able to have one place where, you know, which of course would be the primary care physician, where their families will come together and have all their general information about caring for themselves. Again, the transition to adulthood is, you know, something that we're always working with. Does anybody have anything special? So what I did was, I thought that by giving you the PowerPoint, it would give you the opportunity, and please, you can feel free to share this. So I just sort of talked about all the information that's on the PowerPoint, but can you just go through it? So this is the purpose, this is what we had talked about, but what I wanted to try to do was let everybody see when we get to the website. So you can just keep going. I'll show you. So what I did was I put the exact website into the PowerPoint so that if you click on it, it will give you the opportunity to actually view what the website looks like. We also have this on our website on the Sussex County Health Department. If you go into Special Child, there's icons that are all around the page, and then if you click on them, it'll bring you to the exact website. Because, you know, sometimes it's easier to be able to visualize what we're talking about, you know, when we're able to see it. Like, for example, could you go to the early intervention? Common agencies we refer to it. No, keep going. Yeah, so can you click on the early intervention one? So if we look here, this is like I said, what I did was I was able to bring this up so that you could see what I'm talking about when I speak of the early intervention. It'll show you a little bit about development and where to call if you needed assistance. It just takes a few seconds because it's a little on the slow side. you see here that they'll tell you each month and, you know, what sort of you should expect from the growth of the child. And then there's a number, you know, that you can call in order to get that. So, I mean, I think it would probably take a while for us to try and do each one, but you get the idea. So when you look at your PowerPoint, you can click into, so I have the early intervention, I have the catastrophic illness in children, SPAN, perform care, the Social Security and dorms and independent living, as long as well as the Family Partners and Autism New Jersey, Autism Speaks. So each of these things, you know, offers some kind of information that I think is helpful to families. Also, the ARC of New Jersey, I have that at the end here. The ARC of New Jersey has what we call go bags. Can you click on that one? They have go bags, and these go bags will focus each one on something different. So let's say that you're planning to go for an individual education plan meeting or an IEP meeting. What they'll do is that they have a specific go bag to help you to prepare for that meeting. And in that meeting, they'll give you tips on how you should do, you know, like they'll say, bring a picture of your child so everybody knows who you're talking about. You know, it's your responsibility to know what is in your IEP, what services your child should be getting, how often are they getting it, that type of thing. So are they getting PT, physical, what exactly are they getting, and to, you know what their child is working on so that they can work on that at home, right? Because as we know, it's not going to, you know, just twice a week at school is not going to be enough. We also need more. So this here is the SCARC services. That's not what I was looking for. That's okay. That's, so like I said, they'll have one on IEP, or they'll have one on, let's say you're getting ready for guardianship. So guardianship is something when your child turns 18 and you have to, you know, decide on how that's going to look for you, for your family, and what your child needs. Because at 18, they're expected to be able to make decisions, you know, regarding what's going to happen to them, right? So, but if you have different types of guardianship, there's, you know, a full guardianship, and none of this just comes easy. It's a process, right? And so when you have full guardianship, where you just have some assistance with maybe their money, or be able to hear about their medical stuff, or, you know, it just depends. So even on the ARC of New Jersey, they have a go bag for guardianship, and that will explain to you everything that you could possibly want to know about that. It's just all reading and you know, learning. And another thing that we do is we try to send out information in terms of transitioning to adulthood. They'll have like forums where people can learn more about that, and a lot of times they'll be on Zoom, so we send that information out to families so that if they would like to join the Zoom, they can learn more about whatever subject it is that they need to know about. I think I talked a lot, so we are very passionate, as you can probably hear, but you know, we're always, again, trying to find ways to help our families, if it's outreach or however that's going to look. So I don't know if anybody has any questions for us.
I am going to pause the sharing of the screen if you're done, and I'm going to open it up for questions and stop the recording at this time. Sound good?